Good afternoon, everyone, and thank you so much for tuning back to our Facebook Live today again. My name is Bernard, and I'm a pharmacist from Caring. In conjunction with World Hypertension Day last month on 17 October 2020, it brings us here today again with an exciting topic, which I think is somehow quite relevant to our daily life here in Malaysia. So this year's theme of this Hypertension Day is encouraging people to measure your blood pressure accurately. So before we start, how many of us know the figure of the number of people who is actually experiencing high blood pressure in Malaysia now? So comment your answers below and see if you are right. So while waiting for the answers to come in, I would like to share a piece of good news with those lucky ones viewing online now. We are so honored to have an experienced person who is knowledgeable about the management of high blood pressure with us today. She is the Associate Dean and Head of Department of Medical Science, School of Healthcare at Sunway University. So if, let's say, you have came across any doubt, any questions about high blood pressure, today will be your day to shoot your questions and your doubts at the comment box below, and our expert will answer to you. So without further ado, let's welcome our honored guest for today, Prof. Chia. Hi, hello, Prof. Chia.
Hello, Bernard.
Hi, okay, how are you today?
I'm well. Hello, everyone.
Yes, hello everybody. Okay, so Prof. Chia, just before you come in, I was actually asking the audience, about do they know the number of people who are having high blood pressure in Malaysia? So can you review the answers to them now?
Okay. What has happened is in Malaysia, the country has been doing surveys every 10 years to look at lots of illnesses. And one of the things that was measured is blood pressure, and what was found in that in adults, about 1 in 3 adults have high blood pressure. That's from 18 years and above. If we look at people who are 30 and above, it is much higher. So about 46% will have hypertension. And that is a lot of people. So if you just look around in the room, between 3 of you, at least 1 of you has high blood pressure.
Okay.
So it is very, very prevalent.
Okay.
And of course, how we decide or define whether you have high blood pressure or elevated or hypertension is when your blood pressure is more than or equals to 140/90.
Okay.
The upper limit, of course, is what we call the systolic blood pressure. That's when your heart pumps, and that's the pressure that's recorded. Then when your heart relaxes, that's the lower end.
So means it falls back to the heart.
Right. So either one that's elevated above 140/90, you're considered to have high blood pressure.
Okay. So we understand that with the COVID-19 pandemic concern rising globally and also happening back in our homeland Malaysia, so I think today we will take this opportunity to urge everyone, stay calm, stay safe, and stay protected, okay? But also in the meanwhile, in the same time, we couldn't ignore the ironic fact of the damage of this uncontrolled high blood pressure, which acts as the silent killer in Malaysia. Okay, so I think with this COVID pandemic, it has somehow sped up the online platform evolution, which you see we can have more opportunity to discuss things over here, and also to raise the awareness of our community in health-related topics. Okay, so as a healthcare professional like you, a professional practicing doctor, you no longer can only be available in the clinic diagnosing and consulting patients. Instead, we are very lucky to have more opportunities over here, collaborating together and discuss and explain to our viewers today through this digital social media. Okay, so although we know it is pretty simple to just type in Google high blood pressure management, what are the medications to eat, but since we have a reputable medical practitioner over here. So can you try to share more with the real definition or meaning of the high blood pressure besides what you have raised before this?
Yeah. I think what we firstly need to recognize is that high blood pressure is a silent illness. That's why it's referred to as a silent killer.
Okay.
You do not know you have high blood pressure, although some people say, oh, I feel a little bit of headache, I feel giddiness. But by and large, I would say 90 to 95% people who have high blood pressure do not know they have high blood pressure. And one of the illustrations I would like to share with you is actually a patient. He was 52, he was a taxi driver, and he had a very dense stroke, so his right upper limb and his lower limb could not function, and obviously he can't drive a taxi anymore.
Okay.
So when I asked him, did you have high blood pressure? No, I did not have high blood pressure. I only knew it when I was admitted.
I see.
Then I said, did you not get it screened? No, I've never seen a doctor for 30 years.
Okay.
And so the unfortunate thing is because it's silent, he probably had it for a long time, did not know it, did not recognize it, and did not get treatment. If he had been treated, then obviously he may not be suffering such a disastrous effect on his livelihood.
I see. Okay.
So very, very important is you need to get your blood pressure measured. So what Bernard mentioned about this change in the COVID that has brought about is that previously if you go to visit a doctor, you get your blood pressure checked
Yes,
and whatever thing you have. But of course you have to be sick to visit. Like this taxi driver has nothing, so he never measured. So the thing to do is you yourself have to take charge. You yourself have to ensure you get your blood pressure measured in whatever way you can. That's the only way to detect whether you really have high blood pressure or not, and then get treatment if it's necessary.
I see. So you mentioned that quite a number of people outside there are actually unaware about what they have or might be having. So personally, I'm quite concerned about this. This is something quite alarming for me. So can you elaborate more of your insights with our online viewers there? What can they do?
Of course, what we need to know is how many people who have high blood pressure do not know they have. And again, year in, year out, we do measurements, we do screening. We find that 46% of those who have elevated blood pressure do not know they have it. And that's a sad state of affairs. That means two of you have raised blood pressure, one of you do not know it. And so therefore you do not know, you do not get treated, you do not prevent your disastrous effects of the high blood pressure. So I urge everyone to get your blood pressure measured. And the recommendation or the very simple guidelines as how often you should measure is perhaps once a year. If your blood pressure is found to be normal, I think once a year is adequate. And I always say the year goes by so quickly, like now, it's already November. We say, where has the year gone, right? So I always tell myself, you give a gift to yourself, a birthday gift to yourself on your birthday month, maybe not your birthday itself, because people pantang don't like to have to go and measure blood pressure. It's the month. Remind yourself to just measure the blood pressure. You don't necessarily have to go to see a doctor. You could do your own measurement at home. You could go to a pharmacist, go to a doctor if you want to. But whatever way you like, you have to get it measured once a year. What we're going to do afterwards is to actually show a little bit about how you should measure, what sort of instruments you should measure, and so on and so forth.
So will the blood pressure continue to rise? Since you mentioned just now, some of them, they are unaware about what they are experiencing. So will the blood pressure continue to rise if, let's say, left undiagnosed and untreated? So if, let's say, this really happens, like touch wood, I'm the one having this, what are the possible other health issues that may arise from it?
The thing about blood pressure is as you age, your chances of getting it is higher, partly to do with the hardening of your blood vessels as you age. And so therefore, you would know that, you already by observation know that people are older tend to have high blood pressure. So your grandparents, both of them may have high blood pressure. So, and when you're younger, you are less likely to get it, but there is no guarantee. You're not immune from getting high blood pressure. In fact, in Malaysia, we notice the highest rise, the fastest rise in blood pressure is in the younger age group, between 30 to 50. We expect it in older individuals, but even younger individuals are being affected. Partly to do with our lifestyle. We have very poor lifestyles. We are overweight, we're obese, we eat a lot of fast food, we don't exercise, and so on and so forth. And all these are actually risk factors for getting high blood pressure.
So since we mentioned just now the treatment, so there's a online viewer, Miss Cindy Tan, asking about any side effect for long-term medications patients with high blood pressure.
I think nowadays the treatment for high blood pressure, the medicine that's available are pretty safe. They've been tested for like 30, 40 years.
Yes, correct.
And what we can see, and again, this is research I've also done, is that the number of people with strokes, with heart attacks are all falling. In fact, I was interested to look at it was because, when I was younger, I used to see perhaps a stroke a week.
Yes.
And all due to high blood pressure. And then lately I said, how come I don't see as many?
That's a good thing.
So I wondered, of course.
Yes.
So I did my research and tracked and followed the group of patients who come regularly to our clinic. And indeed, the rate of the incidence of strokes have all fallen. Why?
See.
Because we find the blood pressure has all come down to near normal. Half the people are very well controlled. So in other words, medication works, and none of them actually suffer too bad from side effects.
Okay.
And even if they are not anything we cannot adjust. Perhaps, if you talk about 50 years ago, yes, the medicines were a little bit more toxic, but nowadays the medicines are so free of side effects. And even if you went on it for a long, long time, lifetime, it doesn't do any damage. I think the main fear in most people when you ask them to take a second or a third high blood pressure medicine, they're worried about their kidneys. They think it spoils their kidneys. That is totally untrue. It's the other way around. If you take your medicine, lower your blood pressure, you protect your kidneys very well.
So, Prof, since you mentioned just now that most of the cases are actually silent killer, or you don't really get much of the symptoms of this high blood pressure, we have an online viewer, Karen Law, asking any sign of look out for potential high blood pressure or any symptoms that can maybe alert us to make us more aware towards of this.
Yeah, one thing of course is if your family has hypertension, you're likely to get it. Increases your chance by more than 50%. So that would alert me. It's a red flag to me to tell me I better watch out. And how do I watch out? When I'm younger, I want to prevent from getting it. And one of the ways you can do, of course, is adopt a very healthy lifestyle. Stay slim, be physically active, don't smoke, don't drink too much alcohol, low salt diet, all these healthy things that we should be doing. And that because you remain good weight, low sodium diet, your blood pressure may not rise as fast. It may still come, but you can delay it for 10 years or so. If you keep slim, you might even delay it for longer. So these are the things we can help ourselves in trying to prevent it. But in the unfortunate event you get it, then obviously you need to be treated. And I think, as I mentioned earlier, treatment is very effective, very safe, and I think one should never hesitate to treat a blood pressure that is elevated, that's high.
I think because a lot of people, they have the stigma, I try not to see a doctor because I scared that, once I see a doctor, I have to take this for lifetime.
Yes.
But they might not be aware that what they have been missing out for that.
Yes.
So back to the question, is there any sign or symptoms like based on your practice that they may be aware of, might not be applicable to all cases, but at least when they know they have experiencing these symptoms, then they should be more alert.
Usually, as I said, because this is what we call primary or essential, in other words, there's no known cause for it. Usually there is no symptoms, you don't feel anything, unless it's very, very high, then of course you may get a little bit of tinge of headache, a little bit of tiredness, a little bit of dizziness, but by and large it is silent, and that's the problem. We cannot pick it up, and like the taxi driver, he just ends up with a stroke.
Okay, so Prof, when it comes to high blood pressure, since you said there is some treatment option, is there any cure for this disease? Okay, but before that, guys, don't forget to answer the questions pinned at the comment box below. The question is, give you some tips. If let's say you are following with what Prof has said, they might be providing the answer to you. So back to the question, it is, does family history of high blood pressure increase the chance of developing high blood pressure? Answer yes or no. Remember to hashtag Caring Pharmacy and hashtag Omron and comment together with the answer. And then we will select 3 lucky winners and PM them who get the most accurate answer after this session. Also, don't forget to like, share and tag 3 of your friends to increase your chances of winning. So back to the question, is there any cure for this hypertension or not?
Okay. as I mentioned, most of the time, 90% of the times, the high blood pressure is what we doctors call essential. In other words, it is, or primary. In other words, there's no known cause. Another 10% may be due to kidney disease, maybe due to thyroid problems, and a few other endocrine problems, but they are very unusual.
Okay.
And usually they will come to us with some other complaints, or maybe we pick it up and then we realize that it is not essential. Those sort of things may be so-called cured. But by and large, it is not in a way curable, but certainly it can be controlled. Say, I had another patient, he was very fat, he had diabetes, high blood pressure, only about 42. His blood pressure and his diabetes was very poorly controlled. I had to maximize all the medicine. He says he's taking the medicine, but it could not be controlled. And I said, why don't you do some diet, exercise? He couldn't because he had a very busy working life. He had to eat out and couldn't control the salt in his food and so on and so forth. And then one day, because I went on sabbatical leave, I was away a little, then I came back and he practically lost 20 pounds. He was so slim. So slim. And then his blood pressure was very, very good. His diabetes control was very, very good. So I said, how do you lose all the weight? He said, oh, I stopped working, so I had time to exercise and to watch what I eat. So in other words, exercise, dieting, losing weight does work. So therefore, although he was not cured, his blood pressure now became very well controlled. So when you talk about cure would be, if my blood pressure is slightly raised to 142, you're just slightly elevated, I'm fat, I don't watch my diet. If I do diet control, I do exercise, yes, I can bring it down to say 138, which is normal. That's very good. So you can control it without medication. That's fine, as long as the blood pressure is below 140. And even if you need medicine, if you do all the, like this gentleman I just told you about, even if you needed medicine, because you have lost the weight, your medicines could be reduced, the number of tablets you need and all that. So it's still a good thing for you. So try to aim for a good body weight, a good diet, and so on and so forth.
Yeah, okay. So we have another online viewer here. This Miss Josephine Yu. Taking high blood pressure medication for a long term, is it bad for us? So I think back to the questions you have answered prior, I think we have to weigh the risk over benefit. Definitely the benefit is much overweigh the possible tiny little concern on the side effect, which is rarely happening from time to time. So so I believe that our viewers now have a much better understanding on the overview of high blood pressure. So as you know, we are frequently educating our public. Try to stay at home, avoid crowded places. If nothing happened, try to not to going out. Especially during this CMCO period. So when it comes to blood pressure management highlighted earlier, Prof, you mentioned that we can actually check it at home by ourselves. So does that mean that we are acting like our own doctor, taking authority to monitor our blood pressure?
Yes. I think it's very important that you take charge of your own health. You empower yourself. I'm not suggesting that you measure and treat yourself. You measure it, and if there's any doubt, and if you know that it's high, then you go and consult a healthcare professional. Certainly you need to do that, because there are certain things that we will do as doctors. We will look for possible causes that we can reverse. We can also look at whether you have diabetes, just not high blood pressure alone, because these two things tend to go together. We will also to look whether you have got your cholesterol problems. Again, if there is, we need to treat it. And of course, whether you actually already have kidney disease that's giving you the high blood pressure. So all these things the doctors still need to do. So yes, you measure it yourself. If it's abnormal, you should go and see a doctor. But very important is you must measure it correctly. And that's the theme of this year's World Hypertension Day, is that accurate blood pressure measurement is very important. And that's why we are going to talk a little bit about how you should measure your own blood pressure.
So before we go to the demo side, we have one popping question from this Miss Linda Wong. She's asking, is migraine connected to high blood pressure?
No, migraine is a separate illness by itself. Obviously, if you have migraine, you have severe pain, your blood pressure will go up. So it is the migraine that is causing your blood pressure to go up. Just as if you go out, if I ask you to run very quickly, your blood pressure will go up. But that's the body's normal response. And once you relax, your pain goes away, your blood pressure goes back to normal. So in a way, it is not migraine by itself, it is not a cause of high blood pressure.
Okay.
It can temporarily raise your blood pressure, but it's not hypertension per se, the way we understand hypertension to
Okay.
be.
So thank you so much for your explanation. Okay, before we go for more, go to more comments and answering them, so let's perform a live demo to show them how anybody, even old person, can monitor their blood pressure so easily yet accurately back at home, even without any assistance from others.
Yes.
Okay.
We are very fortunate, I mean, not just for the public, but even for doctors and nurses and other healthcare professionals, that these tools for blood pressure measurement are available. These are the digital sets. They don't use the mercury that we use. It's a lot easier and a lot more accurate than the mercury. So these digital sets, of course, one of which is the one that Bernard's going to use.
Okay.
Basically, what you need to do is to, before you measure, the best time to measure is early in the morning, maybe within an hour after you get up. You empty your bladder, you go and pass urine. You don't drink coffee, you don't smoke, you don't exercise. Just sit quietly for a while, put on the cuff, and then sit for 5 minutes and then start to measure blood pressure. Now, to do that, obviously, you also need to have a good set. You have to position yourself the way the picture is showing. Sit on a chair, arm on the table so it's supported. Your back must be rested. Don't cross your leg. And then wait 5 minutes and then press the button and measure it. You wait, you have to do it at least twice. You wait 1 minute or 2 minutes apart and then press it again and measure it. And then you can see the two readings. The average will tell you what your average blood pressure
Okay, so Prof, since I'm sitting now at this position, okay, why not I will try to demo and to show them how easy it can be, okay? So, but if let's say any parts goes wrong, okay, please share with me so that we can, for those who are viewing online, you can prevent the same errors that which I may have shown, okay? So, so is my position now okay with this, the table?
Top.
Okay, so I'll just put it into my the cuff over here. Okay, so we would like to demo how, if let's say you are staying alone, you can show how to measure this. Okay, so is it like this?
The first thing is the manufacturers have been very clever and helpful. They have these arrows to tell you where it should go over your artery, because you're measuring the blood pressure in your blood vessel. So your our blood vessel actually runs just here, so therefore the arrow must be quite a little bit off the middle, a little bit above your elbow crease, the crease, and to ensure that you do not wear thick clothes, nothing constricting your arm, and then wrap the cuff nicely round your arm.
Okay, so like this.
It's a little bit difficult because, I will usually put on my left arm and use my right arm if I'm a right-hander.
Okay, so is it correct like this?
Yes.
Okay.
Yes.
So what I'll do next is, I'll just maintain my sitting position and then I'll just press the start button.
Wait, usually you rest, wait and rest for 5 minutes.
Okay, ting, 5 minutes over.
Let's say it's 5 minutes, Now
so now I'll just press the start,
So what you want to ensure, you shouldn't be talking, but I'm just telling you, to ensure the cuff is at the level of your heart. Your heart is here. I had a patient who measures it at home, and it seems to be very nice blood pressure. So I said, how do you measure it? And his wife quickly tells me, his wife was standing behind, I said, he lies on the bed and puts his hand up to measure. That is not the correct way, because it gives a false blood pressure reading. So it has to be this position. Okay?
Okay.
Yes, very
Done.
good. Very good reading. Then you wait a minute, 2 minutes.
So this is the reading, I think.
Is very good, well within normal.
Okay, thank you so much.
You usually will wait another 1 to 2 minutes and measure it a second time. Okay, so that, because sometimes the first reading goes very wild for whatever reason, so therefore you want to do it at least 2 times.
So it is like so easy, and it's like I think anyone can do this thing. I mean, it's like just within one button. Everything can be done.
Absolutely. That's why it's not difficult.
There's no reason for you not to measure, right? So we have a question from this online viewer. Okay. any from this Afifa, any complication that I could get if I am not compliant to antihypertensive medication?
Oh dear, oh dear, oh dear.
At least they confess.
Oh dear, of course if you don't take your medicine, your blood pressure is not going to be controlled. And we know high blood pressure, what it causes will be of course strokes, very, very common, very, very devastating. It can cause heart attacks, or heart failure, worse. You know of people who need the heart transplant and so on and so forth. They can hardly breathe, and that's because of continued damage to the heart. You can also get kidney disease. Your kidneys are spoiled. In the end, you might need to go to dialysis. And of course, we know people with high blood pressure and diabetes tend to go together, and so therefore they mix even the kidney decline, the destruction of the kidney even faster. That's why lots of patients with diabetes who also have high blood pressure are on dialysis. And we want to prevent that. I mean, dialysis is no fun.
So it's more of, if let's say your high blood pressure is left uncontrolled, what leads after that, the complication is the one which concerns you the most.
Yes, and that's why we're trying to treat it, because if it doesn't cause any serious problems, why treat it? It is because of that. And as I said earlier, definitely it is worth treating. I mean, there's no uncertainty about it. So therefore, if you have it, treat it, control it, get it to target.
Okay, we have another question from Kaushilia. Okay, she's asking, when is the best time to measure blood pressure? Is there any concern before or after meal?
Yes. So I came to, I started off by saying do it in the morning. That's the best time. Upon, say, an hour after waking up, before you eat your breakfast, before you do anything. The reason for that is because we know that in a day, our blood pressure during the day is high because we're active. Like now I'm giving a talk, my blood pressure will be higher than what my normal is. If I rest, it'll be lower. So the normal, what we call diurnal, the daily variation, is that our blood pressure in the daytime is high. When we go to sleep, it starts to go down. Then about 4 a.m., it starts to rise, because that you must get your body ready to get out of bed. If it's too low, you can't get out of bed. So therefore, that's what happens. And the fastest and the highest rise is early in the morning. And also studies and research have shown that's the time you get strokes, you get heart attack. More common, not that it doesn't happen in the daytime, but that's the most common time. And again, studies have shown that in Asians, in particular Asians, meaning the Japanese, Koreans, and ourselves, that our rise is much higher than a European. That's why we get more strokes. They don't get as many strokes. They get more heart attacks. They get less heart attacks. So these are the things. So the best time to measure in any person, whether if you have high blood pressure, you should measure it once in the morning, 2 times in one sitting, once in the evening before your main meal will be better. So around 6 to 8 o'clock before you eat your main meal. That will be the best time to measure. So when you measure, record your time, record the blood pressure clearly. And of course, if you buy a machine that's got memory, it's even better. Get it for a week, then when you go to the clinic, you show the doctor, we can then look at your readings for the 1 week. Again, if you're on treatment, it is very helpful to me as a doctor, because you come and see me once, you're excited, you couldn't find the parking, you quarrel with somebody, you come, it's high. So it may not be your true blood pressure.
I see.
So if you can do at home, you bring it, I will look at it, I will look at my blood, then I will then have a better decision when I tell you whether you should or should not increase your medicine. So that is helpful. So please do that for about a week before your appointment.
So you get the overall trend.
Correct.
So
over a whole week or so.
When we talk about trend, right? So it means that sometimes the reading may be different. So it comes back to this Miss Sidnu's question. Okay, so hello Prof. How many times should I take my BP readings if each time the readings are different?
Okay. What it would mean is if they are, it depends, you should also ask yourself whether you have rested enough and not taken coffee and so on. If you have done all that, and if your blood pressure varies a lot throughout the day, then you're one of those who have very what we call labile blood pressure. Then obviously, if it's many times it's high, obviously it is likely that the load on your heart is much more, because it's all the time high, certain times it's low. This is one of the occasions where you also need to go and see the doctor, because what we can do is do a 24-hour measurement, and if we notice that throughout a day, 24, you're often high, then the likelihood is you may need some treatment, because the strain on your heart is there.
I see,
But if it's once in a while high, the rest of the time normal, then maybe you don't need treatment.
Okay, so now let's come to a bit of technical part. Okay, so since just now you have you have highlighted to us that we can actually do our own home monitoring of the blood pressure. Okay, so in your practice, okay, as a doctor, okay, what are the criteria you will consider when it comes to the selection of a good digital blood pressure monitor, okay? So I believe that this will provide a good guideline for our viewers out there, just in case in future, if let's say they want to get one.
I think on the whole, the ones that use the arm cuff, the one that you wrap around your upper arm, many of the machines are actually very accurate, quite accurate. I actually test the accuracy myself against my mercury, against other things. What is important, of course, is to buy a trusted brand. There are websites that you can go into, like the European Society of Hypertension, the British Hypertension Society, where you can look up the brands that are validated. Try and use those brands. And if you are not certain, if you buy a set you are not sure of, what I tell my patients to do is always bring me your set. Come to the clinic, bring it, and I will ask them to measure. I will measure, and if it matches quite well, then I say it is accurate enough for your home use. So that's one of the ways to ensure your machine is accurate.
So Prof, okay, so since you mentioned this, right, okay, we have
before I forget, don't use the wristbands because these are like, the watches and so on. They're good for you to just watch your blood pressure, but for medical use, for again telling us whether to treat or not treat you, it is not accurate enough in the sense that it's not been validated. They have not been used in clinical trials, where else we have used all these other machines in clinical trials that tell us if we lower the blood pressure, if the blood pressure is raised based on these machines, it does benefit you. So try not to use those. There are one or two in the market. These are actually professional sets. They're very expensive. They're not like a few thousand. They cost 7,000 or 12,000. So I would not invest in those because it's just too expensive. One of these machines,
is good enough.
300, 400, very good machines you can get.
So since you mentioned that the accuracy is one of our today's main concern, we have a question from Miss Wendy Tan. She's asking how accurate is manual versus our digital blood pressure machine?
If you're talking about manual as in using the
mercury,
Android,
yes, correct.
The Android, which uses air, you press, you have to listen. Right? It doesn't record for you. That uses pressure. Mercury is a gravity column. So therefore, again, it also, you need to listen to it. And we have, of course, over the years found that there's a lot of inaccuracy in there. Human error is very strong. If you don't hear it very well, so on and so forth. So also because now the mercury that we used to use, it's a toxic substance. It's being slowly taken off the market. So we are not going to get those sets anymore. But we get used to these digital sets which uses vibrations to measure, not by gravity and column and so on. And again, guys, don't forget to answer the question pinned at the comment box below. The question is, does family history of high blood pressure increase the chances of developing high blood pressure for yourself? Answer yes or no and comment together with your answer. We will select the 3 lucky winners for today, and PM them with the most accurate answer after today's session, Also, don't forget to like, share, and tag 3 of your friends to increase your chances of winning, So, we have this question from Miss Linda Wong. So she had, my last measurements was 179, done at some pharmacy, and the pharmacist recommends some essential oils on top of the treatment. So will essential oils be helpful for these cases? I think on the whole, all the so-called complementary medicine has not been well proven. So my, again, advice would be if it causes no harm, and of course you wouldn't know it, I wouldn't know it unless we know what the substance is, then you can take it. But to me, all these complementary are very expensive. I find that even I take sometimes multivitamin, it costs me 80 cents. My blood pressure medicine only costs me 20 cents a day. So why am I taking something that's not doing it? You know what I mean? If you can afford it, yes, but I would say that if you have high blood pressure and you tell me it's 179, I say you need treatment with the medical drugs, not those complementary things. It can help, but I don't think that is the answer.
We have comments from this viewer, Miss Jessica Lee. So she has a concern about what are the advisable time to eat high blood pressure medicine. Morning before or after breakfast, after eating lunch. So can we eat the medication on empty stomach? So maybe when this comes to medication, I will try to answer on behalf, okay? Because for blood pressure medication, they are various types, okay? So we couldn't answer based on a general statement, because some of the medication may be affected with your food or without food or different times. So do talk to your doctors or to talk to your pharmacist when you get prescribed the medication, and upon dispensing, then they will advise you on the best suitable time for taking this medication. Is it correct?
Yes.
Okay.
But by and large, most of them really not so badly affected by food or empty stomach. It doesn't bother your stomach, unlike certain types of medicine like the ones that you use for pain, the NSAIDs. It may upset the tummy a bit. These usually don't. The absorption of the medicine may be a little bit affected by food or empty stomach. But again, studies have shown it hardly matters.
Yes, correct.
So if you're taking it and your blood pressure is controlled, then it really didn't matter. But if you're taking medicine not controlled, then you may have to think a little bit about these issues. Not to be too bothered by it, because most of the time we sometimes forget, we'll take it when we want. But again, a good habit will be set it at a fixed time that you know, so that you don't forget.
Like an alarm?
Yeah. And if you've taken it on empty stomach and your blood pressure is controlled, then empty stomach is fine. If you're taking it on a full stomach and it's controlled, then it's fine. You know what I mean? By and large, not too badly affected by it. Okay.
Okay, we also have another question from Barney Ting. Okay, so the question is, okay, the digital blood pressure machine, okay, whether do we need to send for maintenance, such as calibrate the reading?
Yes. I think it's very important. Usually the digital ones are not too bad. The analog ones, you got to validate it every 6 months, because the mechanism gets spoiled easily. The digital ones are quite good, but nevertheless, what I ask my patients to do is bring their machine in, maybe every year or so. And then I would ask them to measure in front of me. One is I see how they measure, whether it's accurate. And then two is then I would measure my blood pressure without knowing what their blood pressure is. And then I look at theirs and look at mine. And if it's very consistent, then obviously the machine is fine. So that's one quick and easy way to validate.
I think most
some companies have already now said you can return it to them and they validate for you. So if you go back to where you buy it from, usually the place where you buy from has knows where to send to the manufacturer to get it remeasured, recalibrated. Yes, in other words, you have to. My short answer is yes, you have to. How often? Maybe once every 2 years, or when you go and see your clinic doctor and it's fine, then you don't need to do it in the official way.
Okay, we have to make sure that the meter you use is accurate. Okay, so we have another question from the same person again. Okay, Sinu, okay, she is asking, okay, doctor, can pregnancy cause hypertension?
Yes, pregnancy induced, what we call PIH, pregnancy induced, it's a different reason for why you get hypertension. That is to do with the pregnancy. Usually after you deliver, the blood pressure goes down. And because if that happens, you're only in your 20s, the likelihood of you getting persistent, that means it is after you've delivered, you still have blood pressure, is a little bit lower. But each time you get pregnant, you're likely to get it. And if your family has high blood pressure, you can almost guarantee or bet that as you grow older, you are going to get high blood pressure. So this is also a predictor of whether you're going to get hypertension in your later life. Because you're in your 20s, when you're delivering, it is not, not always it will present itself so early, but it's a different mechanism, okay? So the warning would be, if I had it, then I better watch my blood pressure, prevent it, take more, measure it more often, make sure I monitor it to ensure I do not get high blood pressure silently and not.
I see. Okay. Yeah. So we have another question back from Linda Wong. Okay. So I really I'm very delighted to see the engagement, because it proves that throughout this session at least we can answer some of their doubts and also their concerns on this topic. So Miss Linda Wong is asking, is there anything or food that we should avoid when taking the medicine for high blood pressure?
Not really. I think, again, most things can be taken with any other foods and all that. There's no serious interaction of any sort with the current type of blood pressure medicines we are using.
Okay, so I think that is almost the end of the sharing session. Okay, to the audience who are joining halfway, so remember to answer the questions pinned to the comment box and the crawler below together with the hashtag, and you might get a chance to win away a Omron automatic blood pressure monitor after this session. Okay, so before we end our session, it was so interactive and so fun. Okay, so do you have any last piece of advice which you think maybe benefit those who are watching or still staying with us for today's Facebook live stream today? So any takeaway message for our audience?
Okay, I think what I want to re-emphasize very importantly is that we all should know our blood pressure.
Okay.
So go and measure it, know it, repeat it every year. And then if you have it, you should get it treated.
Okay.
I think there is no question about it. And of course, try and prevent it, of course. Or even if you have it, you want to make it easier to control. You want to make it such that you do not take too many medicines. Obviously, a healthy lifestyle will be very useful.
Okay.
Adopting a low-salt diet is important because, again, we studies, particularly in Japan, where they've shown Asians are very sensitive to the salt. We tend
too much of nice foods.
And salt is just not, most people tell me, I don't put salt in my food. It's just not the salt that we use in the shaker.
It comes everywhere.
Soya sauce, tomato sauce, chili sauce, all these contain hidden salts that we don't know. So we just have to learn to adapt a little bit to it. In our study in Malaysia, the recommended WHO and good for health is less than 5 grams. We are taking like 9 grams, double the amount.
I see.
So logically, I tell myself, if I cut all my intake by half, I should half my salt intake already. So something like that, you don't have to be too drastic, just go along those sorts of lines. Well-known things like soya sauce, salt, salty food, just cut back on all those things. Eat more fruits and vegetables to balance it.
And of course, we have to make sure that they monitor their blood pressure and get a reliable and trustable brand for that.
That is given, yes.
Okay, so thank you so much, Prof. Chia. I learned a lot today, and I believe that does our audience who are watching right now. Okay, so thank you to all of our audience who have joined us throughout the whole session today. Okay, so thank you everyone. Okay, let's see, we can meet again, and hopefully in future we will have more chance to share with them. Okay, so just let's say bye to our audience. Take care and stay safe.
Bye bye.